Spent too much time in California. Now I got that Rona. Gotta be alone. Staring at my phone. Gotta be alone.
Hey all you cool cats. Hey all you cool cats and kittens. Hey all you cool cats and kittens. It's me, Judy. And we're back for another episode of the thealoneaviruspodcast. Because the real trying element of this pandemic is that we're all experiencing this in these weird alone pods. Maybe we're all alone. Maybe we have a partner, a friend. Good timing. Yes, well, I hope y'all are staying home. I really hope y'all are staying home, doing your thing, eating that food, putting on that COVID-19, if you know what I mean. So, that's about the best you can do. That's all I'm asking for. Wait, didn't hit the camera. So, I'm excited about this episode. Again, we're painting a picture about how this pandemic truly is global and it's affecting everybody. Okay, all right, he's behind the camera. Hey, no. Just relax. All right, don't rub your face against. Nope. Okay. And today, I'm actually very excited to bring this to the world, and on a much more serious note. I talked to my friends Alison and Andrea from Italy. Well, they live in Rome, Italy. And as we know, Italy has been hit. It's been one of the countries most devastated by the coronavirus. So they have an interesting perspective, and they have some advice, and they tell their story of what it's like there now. So I really hope that people will listen to it. I think it's a very important story to tell, and hopefully we can take something from it. Take something right out of it. Hopefully not the coronavirus, but we already have that, so we don't need to take it. Let's give it back to the bats. But they probably still have it too. It's just everywhere. I mean, okay, let's check in. Things are getting still worse. We're on lockdown. Hopefully some places are starting to get it. Virginia locked down till June 10th, which is smart. It makes more sense to just throw it way down there, just cast it way down the calendar, and then reel it back if you have to. But guess what? We're probably not going to have to. I think June 10th is a much more reasonable place to be looking right now than Easter. I think at the time that I'm talking to my friends in Italy, there was still the whole hopeful let's open up by Easter, and Italy has their own take, being a Catholic place. Easter's a big deal for them, so that's something that we touch on, and we talk about how that's gonna hopefully go down or not go down. And what else? Everything's getting political. Masks are being politicized. It's just it's insane. And what I really want to talk about is the immune system and immunity and how things are looking right now. But I'm going to save that for a different podcast on its own. But the mask thing is really kind of crazy because we still don't have evidence, despite what everyone's saying. There's still no evidence that the virus itself is airborne. And most transmissions are from surface to hand to mouth and stuff like that. Unless you're really in like cough or sneeze, well, mostly cough range or talking range of somebody. Because we don't see a super high transmission rate in hospitals. There's absolutely some. Hospital, if you can avoid it, don't go there. If you got something minor, you don't want to go to the hospital. That's the last place you want to be right now. I'm not trying to say that it's okay, but I think if it were truly airborne, we would see much higher numbers, especially in hospitals. And people are going back and forth about masks, and people are saying like, if we had endorsed masks at the beginning, then we would have avoided this. I don't think so. Maybe a little bit. There is evidence that countries that are that have been wearing masks have lower overall prevalence of the disease, but it still has to do with regulations. It's person to person, but most of the masks that people are wearing are not filtering out viruses. They're a reminder that person's sick, let's stay away from them, let's not touch our face, all that kind of thing. And so they absolutely serve a purpose. If I see a person with a mask, and I don't because I don't leave the house, but if I saw a person with a mask, I'm not going near that person because I'm going to assume they're sick because I'm going to assume we're all sick. And that's how we still have to operate because everything's, super backed up. Still don't have a treatment. Vaccine's still looking 18 months away. I did see an interesting thing about, I guess it's like smart thermometers or thermometers that are kind of hooked up to the internet, and you can see on a map pockets of fevers and how fevers are associating with outbreaks of the disease. And right now, that's not super helpful, but as cases decrease and we're out of this place that we are, which we're not, but once we're at a more manageable place, I think that'll be really useful to see, like, there's a big pocket of fever over here in this part of the country. Let's, start up testing. Let's reinstitute self-distancing, all that stuff. The future is going to be interesting. It's going to look different, and I have been thinking a lot about how things are, I think social interactions are going to change, and maybe not, you and your friend, but I think, from a place of coming from working with actors and theater and stand-up comedians, I think those industries might be changed, or restaurants, places where people gather. I think those places might take a hit in the future because there's no way to guarantee that this thing is going to go away. And I want to talk more about immunity, but right now it doesn't look like immunity is a permanent thing. Like, you get a measles shot as an infant and you're essentially good for life. These antibodies don't seem to stick around, and that's something I want to explore more. We don't have a great idea of what that is. There's no great treatment. So it may just be a good idea for a while to not be in groups of a lot of people. And that's going to affect people's jobs and different industries. And it's going to be weird. But, hopefully things like that can get back to normal. I don't want to live in a world without stand-up comedy, shows, live. And I hope, we don't have to. But it's going to be weird. It's going to be different for sure. So anyway, before I get too rambly, here's a podcast with Alison and Andrea in Rome, Italy. Cue in the bistro music. Thanks so much, Alison and Andrea, right?
Yeah.
Am I saying that correctly?
Perfect.
Okay, awesome. I'm Jordan. This is my my new podcast, the thealoneaviruspodcast, and it's kind of like, it's silly, just because what we're most infected by here is like just the fact that we kind of have to be alone, or like alone together, and it's just this weird thing that's like affecting everybody on the planet right now.
Yeah.
And yeah, I just kind of wanted to talk to you and kind of see what your experience has been like. So you guys are where? In Rome?
You're in Rome. Yeah.
Yeah.
And, yeah. So the situation in Italy, it's mostly affecting the north in terms of it being, like the level of seriousness. So I don't know if you're familiar with like regions like Lombardy. Maybe folks have been hearing like that name in the news.
Yeah.
So it's a little outside of Milan. And our hearts have been kind of breaking in consistently hearing that The hospitals are completely overwhelmed. Doctors have been forced to just make decisions I could never imagine having to make in terms of, which patient they might prioritize. It's pretty bad. Yeah.
Yeah. That's kind of what got me to take it seriously, because I was in the beginning the news was not very there wasn't a lot of information available, even when things were starting to happen in Italy and China before that, and people kind of looked at it a little bit like not a big deal for a while. And then I read an article it was like written anonymously by a doctor in Italy, and it said that she had to choose between like intubating like a healthy 40-year-old woman who she was otherwise healthy, and then all of a sudden is like incapacitated and essentially dying from this, and then somebody else, and she's making these decisions. And I was like, okay, I'm not that far away from 40. Like, this is real.
Exactly.
Mm-hmm.
Exactly. And we all have, loved ones who are in later stages of their life and who are, in even more risk. So, like, for example, Andrea's parents live in the north. And so when this all started to happen, even before the quarantine was kind of put into action throughout the entire country, we just let go of any sense of going up and seeing them, just because we knew that it could endanger them. But that's also such a strange sort of feeling of like, these are his parents, and if they get into a situation where their health is compromised,
we cannot go there.
Leave. Like, we can't even leave Rome at this point. So it's very weird. And from what I'm understanding, I think a similar thing is starting to happen in the US. Is that
so I don't know if I fully understand what what it's like in Italy. Is it like a top down, like you can't leave?
Yeah, we can't leave. So, I think it was March 9th is when the entire country went on lockdown. And at that point, we could not leave like our city. So we couldn't even like go to the next, town over. People were still allowed to go out, like to exercise, like if you wanted to take a run, obviously to get groceries or to go to work, or if you needed medical attention. And since then, they've gotten even more strict with that. So if we go out, we have to have a piece of paper with us to show the police about like where we are going, so that they can verify that we're out for the right reasons. And yeah, like I haven't left the building since that weekend, I think. And Andrea's been the one to go get groceries, which is like also a very strange experience. So he always goes with a mask.
They allowed only few people to get into the supermarket at the same time. So we have long lines out of the supermarket. But luckily we never suffered any shortage.
Yeah, like the grocery stores are well stocked. But when you do go to the grocery store and you're waiting outside, people have to stand a meter apart.
Yeah.
The one day they were only letting one person in at a time to do their shopping. And obviously, like when you go into the checkout line, everyone stands a meter apart. Everyone that's working in the supermarket is masked and they have gloves. Everyone's giving out hand sanitizer to people entering the store. So it's very strange.
Yeah. Where do you get the piece of paper that the hall pass?
So it's available on the internet, and you're supposed to print it out. Which obviously, like, not everyone has access to a printer, not even necessarily the internet.
But in that case, the agent that might stop you has some, so you can fulfill in front of the agent, and so you're fine.
So when you walk outside, how are they enforcing it? There's like people every block, or like police just doing rounds, or what does that look like?
So we can only, I guess, talk about like our immediate area. So we're in the center by all the monuments. So it's very regulated here. But we have friends that live outside of the center, and they've kind of given us a sense that it's not so heavily enforced or regulated. Like I can look at the window right now and see police officers. Was it the Esercito? Yeah, like the army folks on the streets. From what we understand, like, you know, the roads leading out of Rome are being monitored so that people can't leave.
They can leave, but only with specific needs. Like, and they have to show this.
They have to show
documentation that allow them to go out.
Wow. Like how? How far from like Lombardy are you guys? Like, if you were to drive there, how long would that take?
Like 6
Driving,
7 hours?
yeah, it would be at least 6 hours, I'd say.
6 hours, okay.
6-7 hours.
That's a pretty significant distance then.
Yeah. But
it's 3 hours with an high-speed train.
Yeah. But one of the things that happened was, what was it? March 8th. So the night before they implemented the quarantine throughout the country, the far right party leaked that this was going to happen. So people in those like regions that were most affected immediately started to leave. And so they traveled back to the south. So now we're starting to see that case numbers are starting to go up in the south.
Yeah. So that was more than 2 weeks ago, or that was about 2 weeks ago.
Yeah.
So, wow, that makes sense. And well, from what I've seen, the total, the incidence rate in Italy overall seems to have been going down a little bit. Like, you're still getting more cases, but
it did for like a few days, and then didn't it go back up? We had like more than 1,000 deaths.
Almost 1,000 deaths yesterday.
Yeah. So it's hard to say like if the trend is actually going down.
Okay.
Yeah.
Wow. And so I've been kind of looking into this, but do you have an idea why Italy was hit so hard, and also why the outcomes seem to be so much worse?
You might be able to better speak to that.
It could be a matter of age, the average age of people. So among the EU, among the European Union, Italy is one with the
oldest population. So Italy's economy has not been good for quite some time. So there's a lot of young people that leave Italy to seek employment. Young people aren't having kids. So the population here just is older.
I see.
We've been, I would say, very unlucky in terms of having outbreaks inside hospital, because at the beginning it was not clear. So people sick get into hospital seeking for help without specific procedures. So it spreaded immediately. And this happened in Bergamo and in the northern areas. Go
ahead.
All together into an area that, like Bergamo and Milan, which was the core of the economy of Italy, in which everyone was passing by, goes back and forth. It spread immediately there.
Wow, I see.
The other thing that I think is important to understand is that Lombardy, for example, has an excellent healthcare system. Like Italy, the northern Italy is like their healthcare system is one of the top in the EU, and even they were like brought to their knees with this. So imagine, an outbreak happening. Like, one thing everyone's concerned about here is it happening in the south, which is in a much different economic situation, and they just don't have the resources, the infrastructure to handle anything like this. So, yeah.
Wow. Okay. And so, like, what is the general vibe? Like, I'm sure you're in touch with other people in your area, your age, like friends and all this stuff? Like, are people still supportive? Like, this is what we need to be doing. We're doing the right thing. Or are people kind of like losing it?
I think it depends. So some people, I think, take this very seriously. Other people, and I have such a strong emotional reaction to this because it makes me so incredibly enraged. Some folks are just like, I want to go get my hair cut. Like, I'm going to go do that. And I'm going to go still have an aperitivo and bring wine and socialize. And I'm sick of this. And that's incredibly frustrating. And yeah, so it depends.
Yeah. Do you think like the Italian culture, as opposed to like a more American culture, who do you think would react to something like a police enforced quarantine? Like, who's going to be able to handle that better, in your opinion?
Oh, I don't know.
Or just nobody, maybe.
I don't know as much about the relationship that like the general population has with the police here.
It's fine, like mutual respect.
Yeah, we've talked about this before, where I like, I've explained to Andrea, like if I were pulled over by a police officer in the United States, I would be like terrified.
Yeah.
I think that there's like a general mistrust of the police in the United States, and here it's different in that way. Like, it's just, he's like, what?
Yeah, in fact, when she explained me this concept the first time, I was very surprised. So
interesting. So you look at the police as people that are helping you?
Yeah, absolutely.
Interesting. Yeah, that's pretty different.
But the other thing that I think is important to understand about the culture here is, I think, so Italians, I guess, have this word furbizia, which is like the cleverness you have to get around the rules, because the Italian bureaucracy is like an absolute nightmare to navigate. So people have to figure out ways to get around it. So there was a lot of concern initially about Italians being able to like follow the rules, with this quarantine, because it's just maybe embedded more in the culture to try to get around, restrictions. But I don't know. I mean, it's hard. It's weird to get a sense of if people are following the rules, because we can't like leave our house and kind of witness, our people out and about. And just because of where we live, I don't know if we necessarily get a true sense of what things look like, because we do live more in like the touristy area. So I think just naturally it's more cleared out because there aren't tourists here right now.
Right. That makes sense. And so how are you guys doing? Are your lives completely different? Like, are you still able to work, anything like that?
Yeah. I go to language school online now.
Okay.
Andrea is much more affected by this, just because, he was going to work every day, and now he works at home. His role is actually different now. So he was asked to be on a task force that's responsible for coordinating companies to try to produce masks and ventilators, like within the country, right?
Yeah. Because all the supplies comes from China. So we are trying to establish some sort of production into the country in order to be independent. Because right now there's some sort of commercial war in China to be able to every country to supply hospital and people. So we would like to be able to produce internally.
Yeah, that makes sense. And is there just a general shortage in personal protective equipment in Italy as well? There definitely is here.
Yeah, well, absolutely. In terms of mask, the one that should be used by MD for sure. We need more and more and more. And we are trying to give to the hospital in the south more ventilators in order that if an outbreak would happen down there, they would be able to help and save people, because like all the hospital needs a lot of ventilators. If they will be suffering an outbreak, for sure they're gonna need ICU for many people.
Does it seem like, just from your perspectives, that the lockdown is working, or is like, I know it's not really a question that you can just answer, but does it feel like things are improving, like generally?
We were talking about this today. So it's, I guess, even at this point, it's like hard to get a sense. I mean, we were definitely happy to start to see the numbers start to drop a few days ago. But like Andrea was saying earlier, that without some sort of system where they're like tracking people, it's really hard to get a sense. Like everyone's just kind of been told, yeah, you got to stay home right now. We have no idea when this is going to end, or how, like what the path ahead is in regards to like maybe just allowing like a sector of the population to resume more normal life. And like for Andrea, you were saying earlier, it's like frustrating because it seems like, you know, looking at places like South Korea where they did implement some system of tracking, that it was like a lot more effective.
Like right now we gave up to our lives, like trying to just following the rules and following this shutdown. But the sense that I'm feeling now is that we're losing an opportunity, because in this moment when most of the people are at home, this would be the right moment to implement a system of tracking in order to be able to just don't stay in a shutdown for so long. Just areas that are not affected by the virus being able to go out and start working again and be productive again, but always monitoring and keep people under control. So if you don't implement this while you have the people at home, I don't know how you can let the people go out again.
Yeah, that's a good point. What sort of information are people getting from the government? Like, is there a timeline in place? Like, is there an expected lift on the lockdown?
Well, right now it's still, I mean, we were told that it was supposed to last until April 3rd, but I think everyone knows that's going to be extended. One major concern is that Easter's coming up, and what is it? Is it Easter Sunday that Italians?
It's the Easter Monday, the Pasquetta.
So this is like a huge holiday in Italy, and everyone gets together, you know, to eat and make food and celebrate. And so I think everyone's afraid of what's going to happen. Are Italians actually going to honor, if we're still in quarantine, which I think it's safe to say we will be, you know, are Italians going to, you know, stick to the rules? Yeah.
Do you think people are willing to put their holiday aside for this crisis, or?
We just got invited to someone's Easter.
Oh no.
So if that's any indication. Yeah.
We are not going, by the way.
Yeah.
Okay. Man.
Yeah.
Yeah, that seems like it's going to be an issue here too.
Yeah.
President's talking about wanting to lift everything by Easter, and I'm just like, that doesn't make any sense, especially like we're weeks behind where you guys are as far as the epidemic, and it makes no sense, and it's definitely scaring me.
We really hope that in your case, the numbers will get slow and slow immediately. But for what we observed, you need time, and you need time in the shutdown. And
I guess right now that varies from state to state. Like from my understanding, the federal government hasn't stepped in and said like, you know, like kind of a blanket quarantine for the country.
No, California is on lockdown, and then it's other states well, I'm in Pennsylvania right now, and we're by county, and it just keeps expanding. So I don't know why they don't lock the whole state down to like try to get ahead of it. Yeah, it doesn't make sense.
Yeah.
It's crazy how contagious it is. Just, well,
Also
Andrea,
because the virus doesn't know any
boundaries. Yeah.
Yeah. So Andrea was asked to be a part of this task force. So that was like last Wednesday.
Yeah.
So I was immediately panicking because I was thinking, oh my gosh, he's going to have to go into an office, which is what we anticipated. He had been told, hey, we're setting up an office for you at the Civil Protection Building. And they didn't have it set up yet. So the rest of the week he just worked from home. And then we found out over the weekend that, 12 people in that office were tested positive. So it's just like, yeah. And this is a situation where, we were I think we were trying to comfort ourselves by saying like, well, he's going into like, a government building. They're probably much more vigilant about making sure everyone stays protected. And, even in that situation, there was an outbreak. So
it's just so hard to get a hold of. It's ridiculous. Yes. Are people talking about immunity and how that plays a role, or like serological testing and that kind of thing?
You would be able to speak more to that. So serological testing would be testing folks
like antibodies
to see if like, even if you had a past infection, right? Mm-hmm. My understanding. Yeah, I'm not sure what the nature of the testing is here. Wait, sorry, getting a message. But one of the things that happened early on was that Italy was actually pretty proactive in testing people that were asymptomatic. And so what started to be shown was that the problem was much larger than anyone had thought. And so the rest of the EU started to react to this and started to like ban Italians from traveling into their countries. And so because of that, Italy responded by stopping their testing of people who are asymptomatic.
Oh my God.
It was a horrible move. But yeah. So
well, even healthcare workers can't get tested here. So
that's what I've been hearing. It sounds insane. I have a friend who lives in New Jersey who I guess was tested not this past Tuesday, but the Tuesday before, and she still doesn't have her results. Like she had to go call like all of these numbers.
What?
She was explaining like doctors weren't helpful. They were like refusing to give her certain medications. Like it just sounded like a nightmare. And she's kind of laughing now because her symptoms have, resolved, but she's like, I still don't know if I had it. Like
that's the same thing that happened to me. Like I was pretty sick for almost 3 weeks and it lined up pretty much exactly like a lot of the people, with the symptoms of the virus. And I was driving home and I was doing my best to keep my distance. Like I avoided the airport. I drove home for 3 days. Like I just did everything I had to do to just like eat or sleep on the road and not talk to anybody really. And so I got home and I tried to see a doctor and they were like, they made it really difficult. Like I went to urgent care and they were like, well, you're going to have to go to the emergency room, but you don't have the right symptoms. So you can't get a test anyway. And I was like, okay. So eventually I had like a televisit with a doctor somewhere else. And she was like, okay, well, you qualify. You have the right symptoms. We can order you a test. And this was a Friday. And then they scheduled the test for Monday. And by the time Monday rolled around, I was totally fine. And they were like, yeah, if you feel better, don't come in. It's not worth it. And it was like a 40-minute drive. And I was like, I'm not doing that. Yeah, so I'll never know unless I get an antibody test.
Right. So was the test do you know if the test that they were going to give you was going to be a serological?
No, it was to see if I was an active case. It was a swab.
Okay. Sorry, I'm like laughing because the word for swab in Italian is tampone. So like every time Andrea says it in English, he's like, oh, the tampon. And I'm like, don't say that.
We need a little comic relief. That's perfect. So if you could give us any advice, if you were talking to everybody right now, everybody in the US, what would you say?
I mean, maybe until any possibility of like starting to track people more extensively, like please stay the fuck home. Like it's not worth it. Don't endanger other people. Like, I don't know if like self-motivation isn't working and thinking about your own health, like please think about other people. You're saving lives by staying home.
Yeah, it's the easiest thing you've ever been asked to do.
Yeah. Like if you're not, required by your work to leave your house and go into your job, like stay home. Yeah.
Yeah. We could also say that rather than stimulating economy with 2,000, I don't know how many dollars, maybe helping people would be better in terms of government. That could be an idea too. Yeah. Because in a way we are having some welfare system that is helping. Like there are companies that needs to lay off people, but those people will receive money, the 80% of the salary for many months till the company will be able to hire them back. So it's an help to companies, but it's an actual help for the people. So I would start thinking about the people that will be laid off or will have no income for the next weeks and months.
Yeah.
Because like for us, it's easy to say stay home because
the government, I think there's
someone taking care.
Yeah. Like,
yeah, that's
into the system to take care of citizens. Even, the healthcare system, like I'm not employed here right now and I can still access the healthcare system for free. When this all started, my parents, I think just out of fear, were asking me to come back to the US. And I was like, I don't have healthcare there. Like, it's better for me to be here. So that's just continually mind-blowing to me, is free healthcare. And just even when you do need serious medical procedures, not being hit with like, ginormous bills. Andrea's dad went through cancer treatment that also involved major surgery where they had to remove an organ and reconstruct it. And I asked Andrea, like, wow, like what was the bill for that? And he was like, oh, he didn't pay anything. And I was like, what? And he was shocked to start to learn like what Americans pay in healthcare. It's just absurdity. And it's
Americans value money over people for sure. Mm-hmm. Not me personally, but Americans in general.
Yeah.
It's pretty sad. So I actually did want to ask you, so you'd rather be in Italy with a taxed healthcare system that's like, maybe at its maximum than here with no health insurance? Or I guess that's
I don't think it's, I obviously wouldn't want to be in a situation where I'd go to a hospital and be denied care because they were overwhelmed.
I guess the question is like, do you feel safer?
In Rome, yes, because the situation isn't at that like critical level here.
Yeah.
So for now, yes. And in seeing what's happening in the United States now, like, yeah, I kind of do feel a little safer being here, just because if I can, assume the trajectory from what we know now, like I'm scared for the US.
Yeah, me too.
And I'm really angry that the people that are in power there have no fucking clue what they're doing, it seems, and have no empathy. Yeah.
Well, thank you. You guys have been great. I do have some like I said, some questions that I ask everybody that I've talked to so far.
Yeah.
If you weren't in quarantine right now, what do you think you'd be doing? It's Saturday evening for you, right?
Yes, it is. Thank you for reminding me. I was like, oh my. What would we be doing?
Well, we would probably.
We might be napping. I'm not sure.
We would probably be. Well, we would probably getting ready to go out having an aperitif.
Yeah. So there's a tradition in Italy, like it's not so much like happy hour. It happens a little later than like the American happy hour, and it's not like the emphasis isn't on getting drunk. Like it's like having a light drink before dinner, and they always have food with it, which is also really smart. Like it's just like you pay like a flat fee and like you're served really good food, just like snacky food and wine or like a spritz or an Americano. It's pretty lovely.
Yeah, that sounds nice.
Yeah.
So yeah.
I hope you can do that soon.
We've been doing it at home, and we're thankful for that. Like after we finish talking to you, we'll Skype with friends who live in Rome as well, and we'll do an aperitivo. Yeah. Nice.
Good. What good do you think will come out of this?
I hope that the systems that are in place will change. Like, I don't know if I have like a lot of hope that will actually happen. Like I worry that we as humans have we tend to like forget things very quickly, and that things will just go back to normal. I think that's my fear. I do hope that people start to realize that the systems that are in place right now aren't working, and that we can start to maybe change them. Yeah, like unbridled capitalism, I don't think is working. And I think that this is, just absolutely revealing that. Yeah.
Great. Yeah. And then my next question is, what do you fear? But I think you answered that as well. And
obviously I fear, we're already experiencing tremendous loss, and I'm fearful for that extending even more. And I think we know that it will, but that's like it's a hard pill to swallow. Yeah.
Yeah. And then the last question I have is, how long are you personally prepared to keep going in quarantine for? Like, when do you think you'll reach your breaking point?
Oh, I don't know. I haven't thought about that. I don't think I've wanted to think about that. So
yeah, okay.
My mind go there.
But I think that we're doing I can speak for myself, but I'm doing very well in quarantine, to be honest. Like, we are very lucky because if we want, we can go out on the terrace and being on ourselves.
Yeah, we do. Like, the building has a terrace, so we can be outside.
And we're not living in a one room apartment, so we can have our own space. So I'm ready. If the shutdown will last, I will last more.
You're way more optimistic than me.
Oh yeah.
Well, great. Yeah. Awesome. Is there anything else that either of you want to add?
I don't know. I think
stay home.
Yeah, stay home. Stay home, please. Yeah, I'm just thankful for you letting us talk a bit about this, and I'm really thankful for you just doing this, trying to educate people, trying to help people have access to more information, letting people share their personal experiences. So thank you, dude.
Of course. I'm doing my best, and I do have to admit it's a little bit self-serving. It keeps my mind occupied in the quarantine, but I am also super happy that I get to share people's stories and try to give out good info. And I hope that somebody hears it.
Right on.
So thank you guys so much for doing this. This was so awesome.
Thank you, dude.
Yeah.
Spent too much time in California. Now I'm in Pennsylvania.
Pennsylvania.